Yes. Okay. Thank you. All right. Welcome. I apologize for the delay. Sometimes when I start this, it doesn't let me record, and recording is obviously important. So I wanted to make sure we could do that. We are good to go. One other thing before I get going is that we're having a lot of storms in the Nashville area, and it has knocked me off of my Wi-Fi here a couple of times. So if the screen all of a sudden goes blank, we may just have to end for the day, and I apologize for that. But hopefully we can, that won't happen, and we can get everything covered with you all. So it looks like we have a great group of everyone, almost all of us here tonight. So we'll go ahead and get started. A couple of housekeeping things. The information on the Brain and Behavior Unit has been posted today, and you should have access to all of that. So there's another, I think it's about a 33-minute lecture from Dr. Terry Combs-Orm, and a couple of slide decks that are somewhat related, or they're somewhat similar, but there's also some differences. So just please review those additional slides. And then there's a number of videos that I have described as either required or supplementary. So just, use those as needed. And I will have the brain unit quiz up. My plan is to post those on Mondays. And then for you all, they're due on Thursday. If that becomes an issue, like if you feel like you need to take the quiz before you submit your CTE or sometime over the weekend, and that Monday issue is a problem, I do want to hear from you all. I know most of you all probably work full-time or have some issues. So I just wanted to give you a heads up that the pattern is to post those on Monday and have them due on Thursday. So I'll just stop right there. Are there any questions about what's coming up for this next week? You can unmute or post in the chat. Okay, I'm not hearing. Oh, is that somebody?
The video or the captions, because I am hearing impaired, and I will. Do I have to refer to the disability services to get for captioning, or do they have CC or the YouTube video?
Okay, that's a great question. So how about we discuss that offline? Will you email me and we can address that?
Gotcha.
Okay, great. Thank you. Okay, any other questions? Okay, well, I will go ahead and share my screen, and we can start. So as I said last week, the format for these our sessions together is really going to be a Q&A. And I want to give you all a lot of time to have some conversations and reflect on your CTEs and ask any questions that you still may have after watching the lectures. Because I provide you with the recorded lectures, I don't feel like I need to necessarily review those here tonight, but I do want to touch on some things, but really give you all an opportunity to speak for yourself and ask questions. And I thought that we could set this up first and foremost through having a kind of a different way to reflect on the CTE, although I imagine that many of you did cover some of these, and wanted to each of you to think about, based on the CTE question that you all just answered, what internal or external interventions that take into consideration the whole concept of epigenetics, and that our DNA is not necessarily our destiny, and that we have an opportunity to provide interventions through parenting or through other policies or best practices that may be helpful to support children and families as they are developing. What kinds of interventions, and essentially I want you to think about what are the social work applications for all of this material, because really that's our end goal. And you covered a lot of that in the CTEs, but I'd like to give you all the floor and to start thinking about what some of these interventions may look like on different levels, and using that CTE as the context. So I would love to hear from any volunteers. And if you want to kind of start with what you wrote in your CTE, that's perfectly fine. But if you have any ideas for interventions either at the micro level with parents and families, other kind of physiological or health interventions, or any kind of more macro environmental or kind of community level or government level interventions, would love to hear from you. So I'll just pause for a minute and put you guys on the spot and give you guys the floor.
If we're talking about, so this is for the previous CTE with kiddos that are from substance exposure.
Yes. Yes.
Well, with those kiddos, actually, one of the main interventions that I wrote about in my CTE touches on a lot of those, where educating the parents in a family micro situation will be a family, environmental, and hopefully physiological intervention if we're basing it on the theory that a supportive home environment helps remediate some of the neurological issues that can be created in utero from substance exposure.
Mm-hmm. So tell me about some of those.
Some of the disorders?
No, some of the interventions. Like, what did you think about? Can you be more specific?
Definitely providing them education on what to expect, especially if you have a substance exposed infant who's going through withdrawal. You're going to have need a whole lot more support because they're going to be crying more, they're going to be more reactive, more irritable. I think a lot of what I talked about just focused around education and how that helps to build a supportive environment. Mm-hmm. In particular for a social worker, it's important to make sure that they have access to you if you're their social worker for this case. Mm-hmm. So you're not leaving them alone with an infant that's not always going to be in withdrawal, but definitely in the immediate term is going through a rough time.
Mm-hmm. Yeah, well, good, excellent. So that's exactly right. So if you have, an infant that may need some care, some additional care because of whatever, issues the substance exposure prenatally may have caused, you definitely want to make sure that you're addressing that and responding to that need in an appropriate way. In terms of actual genetic risk, can anybody tell me how you would explain that to parents in your own words, maybe on a fourth grade reading level, a fifth grade reading level, just in simple terms, how would you explain the increased genetic risk that this particular infant may have based on their parents' history of both violence and substance use? Are there any words or phrases that you all came up with for your CTE, or even just kind of speaking, just in general? How would you explain, what would you want someone to say to you if you were about to adopt a child that you knew had some elevated or some risk associated with that, either drug exposure or just parents who use substances in general, and maybe it wasn't actually in utero exposure, and also a history of violence?
I think I would talk about the fact that the child is going to have genes and chromosomes from both parents, because that's every human has those things from their mom and their dad. That's just how it works.
Mm-hmm. So what can we learn by so in this case, I think it said that both parents had histories of violence and substance use. So how would you frame that conversation about, we do inherit our genes from both parents, and what that might mean for the future life and behavior of that little baby? What would we want to tell the parents?
I think I would definitely just be honest and say that there is a likelihood that like the perfect combination, I guess, could occur. Like the child could receive the exact genes or the exact genetic material from each parent that could combine and cause the same issues.
Yeah. So it definitely. Yeah, sure. Go ahead.
I just want to bring up a point on the genetic material. I would tell the parents it's possible if the child might have the exact same gene with the both parents, but I think what we need to focus on is environmental factors that could that come into play on influencing those genes. And a lot of those research that I've read during this week said so much of the environmental had a huge impact on what kind of genes. So it doesn't mean that your child will have or will get violent behavior. It just means this child had a genetic history of violent behavior. But there are other ways and interventions that can prevent the child from getting violent and through intervention, positive parenting, those kind of things.
Mm-hmm. That's exactly right. And I think when one of the things that may be important when we're talking with families, especially, this is a really, vulnerable time for this family, this, potential adoptive parents. They're, potentially hearing some information that may be kind of scary or concerning. So it definitely would be important to, validate their concern and say, I hear you. Let's talk about, what you're actually worried about, and really let's break that down and figure out if there's anything that you do have control over in this situation, and where you basically empower the parents, like Lauren said, with education, and, Noel said, with really impacting the environment that this infant is going into. And when you have a conversation about risk, it really does shift things from, like if you smoke cigarettes as an adult, you are at an increased risk of developing cancer. It's actually not even guaranteed that you will develop cancer, but based on your genetic makeup, how much you smoke, other environmental factors, that may, all of that's going to go into your increased risk. But it's not a one-to-one determination that if you do this, then this will happen. And so when we're talking to parents and people who are unfamiliar with the background of this information, maybe providing some analogies or other things like, you may have a gene that puts you at risk of developing cancer, but that doesn't mean that you're going to. And you may have a parent with schizophrenia, but that doesn't mean that you yourself are going to develop schizophrenia. So there are some options, and I think leaning into aspects of both, acknowledging that there is potentially an issue, but also that there's both genetic risk and genetic potential. So you want to do environmentally and parentally what you can to mitigate the genetic risk, while at the same time you're really nurturing and promoting that genetic potential. So I'll stop there, and I think I have some, let's stop sharing real quick. I think I have some comments on chat. Okay, y'all are chatting. All right. So who else can add? Who else can add to the conversation? What would you want to tell your fellow friends or parents about how to maybe potentially? What are some options? We talked about education as an intervention. What are some other interventions for kind of thinking about mitigating this genetic risk?
Oops.
Go ahead.
I Oh, can I go?
Sure. It's hard for me to see who. Yeah, if you talk, your face will come up on the screen. So
Okay. My husband and I adopted 3 children that were polydrug exposed prenatally, and they were 3 months, 18 months, and 3, and now they're all adults. And we had this question was exciting for me because we had the experience of seeing them in a different environment bloom and grow, and they're 3 successful adults now. So this was the great first question. So, but I think environment and intervention, because my son went through a RIP program, which was basically training parents how to reward good behavior as opposed to bad behavior. And it was a simple thing, and it really wasn't for him, it was for the parents, but it made a huge difference. So early intervention is very positive.
yes, it definitely is. I think that's a great point. And and kind of going back to the concept that, the parents really do have an opportunity to impact this child's life, and what they're doing, this decision that they've made to adopt this child, that's a huge, as you're saying, is a very life altering decision. And so to hear at the beginning that you actually do have some options for improving that child's life, and that that their DNA is not necessarily their destiny, just like our DNA is not our destiny. And also thinking about one of the things that spoke to me was, we talk about all these negatives and all of this genetic risk, but we also know absolutely nothing. One of those parents or both of those parents could have many talents and many other things that they could have passed down to that infant that are just sort of waiting. So kind of like this genetic potential I mentioned, they're just sort of waiting for this nurturing, loving environment so that those genes can be expressed, as opposed to maybe some of the propensity towards violence, which is, as the research showed in one of your readings really covered pretty explicitly. You have there is a gene in one study. There was a gene that said that they found was basically a predisposition towards violent behavior. But if they were not severely abused when they were children, they actually were less violent than the general population. So just because you have that gene, it doesn't mean that that gene is essentially going to manifest into actual behavior. But with those particular folks who had that gene, if they were raised in a severely abusive environment when they were young, it kind of like it turned that gene on big time, and they became very, very violent, and much more violent than the general population. So really thinking about how to maximize this genetic potential and mitigate this genetic risk is a big deal. So great, thank you for sharing. I think we had somebody else Alyssa, were you about to share? Somebody, there was like
it was me.
Okay.
I touched on in my CTE again about the parenting classes. One of the articles we read talked about how parent and child communication skills and nurturing environments and even self-regulating stress will help a child, because a lot of, to my understanding, drug use is due to stress and looking for an escape. So teaching the children as they grow up proper ways to deal with stress, proper coping mechanisms, will help to reduce the likelihood of them using drugs as that outlet to reduce their stress levels.
Mm-hmm. Excellent. I was waiting for somebody to bring up that point, because that's essentially addressing, it's a little bit preemptive, but it's also or kind of more prevention focused, which is great, but it's also acknowledging that this infant does have this risk, and as parents you may do everything right, and it still may manifest. That gene still may be turned on, and there may be it may go that route. But even still, there are things that you can do to help address that. So, things like mindfulness-based stress reduction, or any of those. Teaching that infant to self-regulate from a very, very young age by being responsive, and, to their needs in a consistent way, making sure that attachment is solid and healthy, and really helping to, like you said, really reduce that stress, regulate those emotions, being able to just simply talk about emotions. All of those can have a big long-term impact, even if they still might be kind of quick to anger or have kind of more reactivity, which is what that would look like in kids a lot of times. So even still with that, there's healthy, loving, appropriate, evidence-based ways to support those kids. Good. Excellent. So we talked a little bit about micro interventions. Are there, thinking about this from a policy perspective, are there any ethical implications that you all can think of that might be important as a social worker for you all to understand? So kind of taking a step back, I know many of you may be really kind of micro clinical focused, and that's great. But kind of taking a step back, really looking at this from a big picture standpoint, are there, what are some sort of, I like to say, that's a slippery slope. What are some of these things that we may want to be careful, just maybe even stepping away from the CTE conversation for a second, just looking at this whole idea of, epigenetics and what that means. It's really saying that, we're transferring, issues to our children that, maybe we didn't know that we were doing it. A lot of this science is extremely new. And so as it starts to come out, and I expect it will in the next 5 years, what are some of those things that would be important to add to the conversation from a social work perspective?
Policy-wise, if we're going, I suppose really big, when the MAOA warrior gene data came out, there was big discussion if we should start profiling people by and because of it. And I know that comes with a lot of political implications that we would have to be aware of as social workers if it did come to our state or our jurisdiction, if we were going to treat people a certain way if they had that gene or not, or if they qualified for something because they had that gene or not, if it led to extra therapy as a conjunction with something else or that sort of thing. And in particular to our case, I know if any one of us wanted to do medical social work, I'm not in Tennessee, but I know we would need to be aware of what our particular hospital and state policy is if there is a substance affected infant born into the hospital, since there are definite policies on what to do and who to call in those situations.
Yeah. Good.
I think, can you hear me?
Uh-huh.
Cool. I was really moved by the implications in terms of social justice that were talked about. Obviously, there is a lot of discussion about access to food and, preventing exposure to toxic chemicals, which has direct correlations to poverty. But in addition to that, it was really interesting to me. They sort of briefly started to talk about generational discrimination and generational oppression. And I think something that I have been starting to gather from a lot of this is that we're all much more responsible than maybe is comfortable for us to think. Because, if you have these ideas that people are just going to be how they are and it's in their genes and there's little we can do, that kind of, you're not as interconnected necessarily, but with, new information on how we interact with the systems that we've created, the implications feel very weighty to me.
Mm-hmm. Good. I couldn't agree more. So I teach this class in the daytime as well, and we had some interesting discussions with the face-to-face students, and one of the students brought up this example of she worked in jails, and they had a lot of women who were incarcerated and while they were pregnant, and started talking about, if you just look at things like nutrition and stress levels and sleep and all of those things, when you think about the crime that was committed, and this woman is, she's paying the price. She got convicted. She's in jail, but she's also creating a life. And it really made me think about, from a policy standpoint, should we be taking some extra steps for those women who are incarcerated and pregnant? Because that baby that she's growing inside of her was not convicted of that crime. And is, so it's like, I kind of feel like the system is really punishing both the fetus, the unborn baby, and society as a whole, because you do have options for thinking about maybe having some segregated units, maybe making sure that nutritional intake is elevated, that they have access to prenatal vitamins, prenatal care, and I believe that there's some of that, but I don't think that it's to that degree, and it's really based on the value of we're trying to take care of someone who's really innocent of this crime, but we're having to deal with it. That was an interesting example that came up in our class. What are some other things that came up for you all thinking about this from a policy standpoint?
One thing I thought about, like going off the food insecurity, as far as like policies a while back, they were looking at drug testing for, SNAP and stuff like that. And I think it got voted down, if I'm correct. And I just think about, if these women were pregnant and didn't have access to food, whether it's SNAP or just in general. I think I remember in the video, they said that the most important time for methylation and those kind of silencing, all that stuff with the genes is actually before you even know you're pregnant. Mm-hmm. So, you think about, the purpose of these programs is to set people up for success, but if they don't have access to nutrition, like you were saying, in the jail or just in their community, we're not setting them up for success. So that's one policy, like macro approach, that kind of really stood out to me.
Mm-hmm. Yeah, I agree. What did you all think about, they mentioned in actually two videos. One was the ghost in our genes, and then one is embedded in this lecture, so some of you may have watched it, but then I just kind of reposted it outside of the lecture slides on Blackboard today. But it talked about this idea that we, as kind of citizens, needed to be guardians of our genome. What did you all think about that? Did that bring up any issues for anyone?
I kind of thought from going back to a policy standpoint, that when you look at all of the allowances that society will give when you have a physical challenge that you can actually see, mm-hmm. as opposed to when you have chemical and physical changes in their brain, there's no real pass given, so everybody else was kind of saying, I don't think that we are building these safety nets, and we are giving programs to people in the prison systems and even people in society, and educating those who are adopted and making it accessible enough and known enough to everyone, because it's just not something that, when you can't see it, mm-hmm. it's hard to, I think, get the attention for it. Does that make sense?
Yes, it does. It does. And policies are really, they're always values based. So, it's really one of those things you have to, when you analyze a policy, you're really looking at, what are the values that are present that are being promoted, and things like, drug testing for, people who may be on SNAP or other kinds of welfare applications. That's saying that, we don't want to support people who have an addiction. And it's, but if we were to say that you can't be on SNAP if you have cancer, or kidney disease or heart disease, everybody would be up in arms, because there's still so much stigma around around mental health issues and behavioral health issues because they're so hard to see. You can see the behavior, but so much of that is subjective. So I agree. I think that makes a lot of sense. And I think that's one of those things that we look at as, this kind of slippery slope. There's kind of, as I sort of say, there's a light side and a shadow side to all of this information. For me, the light side is that we are learning more and more about human development and human behavior and why we do what we do. And we're, learning more about how things like stress and obesity and other chronic health conditions can get passed down from generation to generation to generation, and which really winds up having larger community impacts, especially for specific vulnerable populations like people who are poor, live in the inner city. And so we're learning all of this, but then it's kind of like, what are we going to do with it? And that's why I really invite and challenge all of you to think about this information. And as I said last week, really apply it to whatever areas you're passionate about. Get comfortable in talking about this, because I promise you that as the years go by, you may be in the field 5 years from now, a lot more people are going to be talking about epigenetics and really getting well versed in this and why it's important and what the implications are for social work practice, and especially on vulnerable populations, will be really important. So any other comments about that? Thinking about policy.
I was just thinking, can you guys hear me okay?
Yeah, it's a little background noise, but if you talk, I think it'll be okay.
I know, I'm sorry, I'm at Starbucks. I was just thinking about taking this to the field that we're all passionate about. I work with youth who have already been adopted, and I myself am adopted. I wish I had known, and what I will be telling these youth who are now in adolescence and dealing with trying to form their own identity, is that you're not what your DNA makes you. And I just think on that level, I wish someone had told me that as an adolescent, and I'm definitely going to take it forward in that arena. So
I just had a thought, Lindsay, I'm really putting you on the spot. Take it or leave it. I'm not offended in any way. But if you are actively working with youth, especially, who have been adopted, who really are, it's kind of like, the CTE question, right in your, in your real life there. Maybe you could just play around with coming up with some talking points or some kind of graphic or a flyer that helps to actually explain this. And it could be something that the organization that you work for, maybe adopts, or it becomes part of a training that you have for youth who have been in foster care, youth who have been adopted, learning how to, like I said, just getting, facile with this information, learning how to talk about it, feeling good, feeling comfortable about it. Who knows what you're going to come up with. But I like the way that you're thinking of just thinking about, how can I apply this to my area that I'm focused on, working in, passionate about. And I really think that right now, even though we're just jumping into this material, that you have connected the dots enough to be able to actually do something about it. So, bravo.
I know for me, this information, I work in mental health in I work out in the country. We're the only mental health and substance abuse provider. People, you still we have houses where people don't have access to just general utilities. And I'm a case manager, so I do very basic skill building with them. And I do a lot of education with parents on just, base level parenting skills. And I know learning this gave so much more gravity to what what feels sometimes, just telling a kid to breathe when they get angry seems small, but teaching them these behaviors, it literally changes them on, their gene expression. And I went back to my office and I was like, guys, listen to all this information. So I feel like it's already within just one small assignment. It's just, it definitely changed how I view what I do. It just seems so much greater, these small things that sort of seem monotonous when you have 70 kids that you're doing these same skills with. But I feel like it's already affected my practice.
Good. Well, I can't wait to see what happens when we get to the stress unit, because that's one of my favorite units. And I'm like, okay, we're all stressed at some point. let's talk about what's healthy stress, what's not healthy stress. And it's actually, I was just telling another student I was meeting with in my office earlier today, I said, I used to have the quizzes, they used to be 30 minutes and now they're 50 minutes because I started thinking, your hippocampus is actually shutting down when you are stressed, and you are probably not going to be doing well on these quizzes, and that's really not the point of this exercise. So good. Anyway, I digress. But I'm glad that this information has been immediately helpful to you, and I think the other units are just going to build on this. That's actually why we start with genetics and epigenetics, is because everything else really builds on that. Good.
I do have one thing I would like to say.
Oh, sure. Go ahead.
I think maybe like from a policy standpoint,
okay,
or a program standpoint, I would like to see like more awareness about ACEs, and maybe you can even teach more about epigenetics on like the grade school level, just kind of at a lower level, of course, but just that way you can start introducing it so people can kind of grow up and get a grasp on exactly what this is. That way, when you go further along to want to put money into systems and things like that, people understand what it is.
Mm-hmm. I think that makes a lot of sense. And right now, are you in Tennessee or are you somewhere else? Where are you?
I'm in Tennessee.
You're in Tennessee. So in Tennessee, ACEs, the Adverse Childhood Experiences Study has finally, even though it was published in 1997, we're almost 20 years out. And it finally is, we've reached that tipping point, and it's being integrated into a lot of policy, and the governor even just dedicated about $1.25 million just for ACE awareness, and thinking about, how do we start to talk about ACEs and reduce ACEs on a more global scale, because it really is a public health issue. And thinking about what you said about epigenetics, and thinking about, how do we start to talk about this even with our children, is when you think about it, it's a public health issue. It's not something, epigenetic changes happen all the time, and it's, they happen to all of us, and so they matter to all of us. So figuring out how do we get this information out there. And I think epigenetics, the finding out about this is a few years behind where we are with ACEs. And so I really do believe that the ACEs policy work is going to pave the way for is really going to pave the way for the epigenetics conversation. I feel very certain that within the next 5 years, it's going to become much more relevant to more people, and the knowledge about it is going to be much more widespread. The difference in just even media coverage and news coverage of epigenetics between when I taught this class in 2010 and now is, exponential. So I think we're on the forefront. So I'm glad that all of you are being challenged today to think about, how would you apply this, and thinking about, how do we talk to different populations about this? And we're definitely going to talk more about ACEs under the stress unit. Any other comments?
I had one.
Yes.
I would like to bring up.
Oh,
were you talking?
Oh, I think Carolyn was talking, or Carlin. What's your name? Oh, I think you're frozen.
All right, can you hear me now?
Yes.
Okay, I was just going to say I work for a small mental health organization, and TennCare is mainly what the clients that we work with for case management. And ACEs is part of the change that's going to happen for our whole case management. They're restructuring us, and ACEs is part of it.
So you mean you're going to do an ACE, the ACE screen? It's not a screener, but the ACE questionnaire with your clients? Is that what you mean? Or what do you mean?
They told us all of the changes that are going to happen, but it's like we're going to behavioral health homes, or behavioral health homes, which is, it's not like a residential facility like it sounds. It's just we're changing our case management structure. Mm-hmm. But ACEs has been talked about for about 6 months now at our quarterly trainings. even with the therapist as well. So I'm even more curious now what the changes are going to be in the fall for us.
Yeah, I mean, because that could be a really big deal. I hope you come back and share with all of us, what those changes look like, because the fact that we're finally getting to the place where you had one research study that's resulted in a number of other, 50 to 100 published articles, that now it's actually finally trickling down into the practice level is really exciting. So I'm curious to see what happens.
Yeah, I'm so excited. Like, I think it was Hannah earlier that said it was just kind of blowing her mind, all the things that she's learned from it, and she's going into work and working with it. Like, I feel the same too. I'm like, okay, so there's a chance for us to maybe silence those genes to where they're not going to continue to be products of their environment. Like, what they grew up in doesn't have to define the rest of their lives. So I'm really excited.
Good. I worked with a program that was specifically for parents of who use substances, and their children were at risk of DCS custody because of their parental substance use. And they started talking about ACEs with those parents, and it was a completely transformative experience, because they realized, I mean, not to the point where they were saying this is not my fault, but it was like something clicked with them, and they realized that they were engaged in a pattern that they grew up with, and that they were transferring that pattern to their own children. And it wound up being a very empowering opportunity, and a real kind of light bulb paradigm shift moment for those parents who are very, very much at risk, and and for the future life of those children. So I think you definitely have to be careful about the way in which you talk about ACEs with parents. But I remember one of the moms that the program worked with said that she'd seen, she had something like 7 different people in her house, and different kind of social worker, case manager type people, and child welfare workers. And our program was the first time that anybody had ever asked what happened to her when she was growing up. And so it also, I think, made her trust our program even more. So there were lots of good potential things that can happen when you start talking about ACEs.
I also just wanted to add that in the midst of all of this, it seems like we're called as social workers to crisis situations that are not preventative, but this science allows us to be more preventative, to go ahead and go on the offensive and address these issues, like in the adoption scenario, address the issues before parents are like, I have no idea what we did to this kid, or this kid's a bad kid, they don't know what's going on. All these different things where they're feeling so abnormal, but to address that on the forefront and say, hey, we're with you, we're together, we care about you, and come up with a plan, allows us to completely flip the script and make sure that it's no longer a moral issue or an individual issue, it's an everyone issue, which is something that the science is really just opening up the doors for that, I think.
I agree. I think that's a great point, and I think it puts things in perspective. And it also reminds me of something else I wanted to mention about the whole genetic conversation, because how many times have we as social workers, especially if you work with children and families, you'll come into contact with a parent who just says, he's just a bad kid, or she's just a bad kid, and it's kind of like this whole bad seed idea. And I think all of that really comes from genetics. I think it kind of goes back to that whole nature versus nurture, and people are kind of quote unquote bad just right from the start. And so really, like you're saying, flipping the script on that conversation to say, our genes are not destiny. And it's just simply, and when you think about it, if you're saying, and it always makes me laugh when especially if it's a biological parent, where you're like, well, technically what you're saying is that you're bad because if that person came from you, then that's all, you got half the chromosomes right there in that child. So I really, any time that you can break the myth around, genetics being destiny, or that simply a gene in and of itself is bad, I think that's when you get into, there's always elevated risk. There's, genes that code for this, genes that code for that, and we can talk about it in terms of risk, but thinking that, as a whole, that someone is bad or defective in some way simply based on their genes is, I think, one of the worst slippery slopes, and can lead to things, like eugenics and trying to, breed kind of superhuman perfect babies and all of that kind of stuff. And I think I would not be surprised if, as the epigenetics conversation evolves, that all of that stuff, that's one of the big shadow sides of this. And I think being prepared for that aspect of the conversation is important as well. Good. Any other comments?
I just wanted to bring up.
Okay, can you hold on? I think Nawal's talking, and then we'll get you.
I just want to bring up a point where, at their generation, where it's important to kind of educate the children. A lot of the children don't really understand why things are happening to their bodies, or their parents are telling them, you're just a bad kid, it's just like treating them the way they're supposed to treat, and teaching children at this age, saying, here's what our body does to us, here's why we might have reacted that way, and kind of teach us mental health will help us be more aware about these issues.
Mm-hmm. Yeah, absolutely. Great. You had a comment?
Yes, ma'am. I just wanted to say, I was reading, and it talked about the word resilient and how organism or people have the ability to overcome, whatever they've been threatened by, what it says, environmental, whether it's in dieting or whatever the stressor or factor is. So when it talks about the genes and the chromosomes and the mutation, I think that if mentally we as adults and then children be taught that they can overcome, with that positive feedback, positive reinforcement all throughout their life, then they could succeed and overcome and become whoever and whatever they want to become. And not saying that because of their genes or genes were damaged or destroyed, that's who they are. That's who they are because of who their parents were, but they can be overcomers and overachievers.
Absolutely. Thank you so much for bringing that up, because resilience is key. And I want you to remember what Shawanda is, the point that she's brought up when we get into our brain unit and we start talking about neuroplasticity and, when we have these kind of real critical periods of development, and thinking about the implications for social work practice and policy practice around, what the science is telling us is most important. Because when you talk about resilience, you're really talking about a child's ability to respond to their environment. And so figuring out how can we shape environments so that children can really use these critical periods to kind of, get them over the hump and really be able to overcome whatever adversity it is that they are experiencing. I think that's really exciting. I think that the more that we learn about very specific periods of time, we can potentially have a huge impact, even on things like language development. And when we get to next week's unit, we will, there's a fantastic video, it's about 10 minutes, called The Genius of Babies, which essentially, talks about this window for language development that's between 8 months and 10 months. And there's something kind of miraculous that happens with babies around this time period. And language is the birth of so many things, including resiliency, because people have a better ability to overcome adversity when they can talk about it. Really kind of connecting the dots there. When you can, CBT is only effective if you can truly understand, what your cognitions are and what they mean and how to change them. And also with things like just how well you do in school, and your vocabulary and language really matters in that place. And I think about, babies who are in child welfare system in DCS custody, and maybe going from caregiver to caregiver to caregiver during that, first year of life, and what, massive implications there are for the language development of that particular child. And I think, I hope that by the end of this course, you'll be able to sort of pull pieces from all of these different concepts, like stress, and how we how that's a physiological response, and, the brain, and how that impacts our behavior, and how epigenetic changes are relevant to our everyday life. So great. Thank you for bringing up resilience, core issue.
I have a comment.
Yes, ma'am.
Going back a little bit to like you're just a bad egg, it's just your genetics. From an epigenetic standpoint, also that can also just create a self-fulfilling prophecy, whereas positive reinforcement and everything can make them overcome whatever problems they have. That negative, always, well, it's just your fault and it's just your genetics, will have that same kind of negative effect on them mentally and even genetically. So it just becomes a self-fulfilling prophecy that, will they just become that troubled that they're constantly told they are.
I think that's a really good point. It definitely can happen. I don't know if we know all of the mechanics behind how that is possible, but we're definitely learning from those studies, like the Dutch hunger winter and all of the research done in over calyx about, the certain time periods that wind up being really important for how you're really transferring genetic risk down to your children. And a lot of that, and especially now what we will be learning over the next few years with the studies from 9/11 and the women who were pregnant during that extremely stressful time, we really are still trying to figure out, how does that really transfer, and so it's pretty exciting that there is research out there now that's really looking at the mechanisms for kind of what you're talking about with that self-fulfilling prophecy. So if you are kind of stressed continually day in, day out, and how your brain changes and the neural connections in your brain, with all of that negativity, what does that do to you? And then what does that do to, your future offspring? It's a really important point.
I've got a question about one of the journal articles. And it kind of
I'll do my best. I'll do my best. Okay, which one?
It was talking about memory kind of being passed on. Like they had done some studies on groups of people who had, were starving and had undergone extreme poverty, and that their children, had some predispositions because of that. And it reminded me of something that in biology class I had, back in college, was memes. Where there's like memories in your DNA. And so is that the same thing as epigenetics? Is that the same kind of study? It's just called a different name, or is that?
That's a really good question. I'm not sure that I know the answer to that. You said you were calling them memes?
Memes. It was a Richard Dawkins study, I think it was actually. I had to do a paper on it, biology. I don't remember much about it. But it was where memory was passed on in DNA. It's like an evolution kind of survival.
Yes. I mean, that is, yeah. I mean, I can't speak to that specific study, but the concept that, memory, that an experience in 1946 gets encoded into someone's DNA and then passed down to their children, that is essentially epigenetics, because it's just epigenetics is talking about the mechanics through, methylation and histone modification that the switches are being turned off and on. So it's basically saying, okay, we've got this DNA, so we have a certain set of genes, but which of those things are being expressed? And that's where we get all of those differences with the twin studies, which is why those are so critical, is you can have the exact DNA, but we see that experience make some of those genes express in different ways. And so I think the memory aspect is true. And it also, just to touch on the evolutionary aspect, epigenetics is, at its core, is a conversation about evolution. It is saying, and this is where I just get into the magic of the universe, or whatever you believe. This is just a much bigger conversation than me, but when you look at the Dutch hunger winter, essentially what they found there is that those women who were pregnant during their second and third trimester, when they were starving, mom was saying to her baby, when you were born, you were going to starve. You are entering an environment where starvation is happening. So I am going, in the magic that is, me growing a life inside, I'm going to do everything I can to better prepare you for the environment in which you are going to enter. And the same is true with hunger. The same is true with stress, which is why you have kids who wind up being very reactive when their moms were very, very stressed when their babies were in utero. So the difference is that if you take that baby who's essentially coded to better survive in starving conditions, and you give them lots of access to food, those are the folks who are going to have higher rates of obesity and heart disease, because they're storing fat and they're storing sugar like they are in starvation mode. And I think that, that's why I think we think theoretically that why obesity is so prevalent within poor communities is that if you're essentially coding all of these genes that says get ready for starvation. So it really is an evolutionary conversation.
And reaching back a little further into the evolutionary aspects, can't you also take this epigenetic theory and apply it to things like Jungian collective unconscious theories, where we're afraid of spiders because our ancestors were afraid of spiders because it was such a threat to our continuation?
I think you can go there. I'm not sure if there's been any, research per se on that, or kind of connecting the dots with that specific thing, but I definitely encourage you to continue on with that line of thinking, because it's really one of those things. I mean, I actually read an article, not to get religious or anything, but I did read an article that was making the connections between what the Bible said about having, that it's something like the sins of the last 7 generations, and it's like now we're actually seeing that there's aspects of that are very true to through all of these epigenetic changes, because what you do in this lifetime, and if you produce offspring, you're passing all of that information down, and it's for a very good reason, because you're preparing that life to survive in the best way possible in the environment that the mom and the dad were raised in, and that the fact that it's equally coming from mom and dad, and it's not even necessarily about what's happening in utero with the mom. So I think there's a lot going on. That's why I think there's some serious ethical implications when we think about values around all this stuff. So, well, I want to be respectful of everyone's time. I'm happy to stay on for another few minutes, but it is 6:32. So we are scheduled for an hour tonight. So are there any last questions from anybody, or any last questions about the upcoming week?
I have a question about the CTEs.
Yes.
I could not get my Word document to copy and paste into the forum or the thread.
Okay.
I don't know if it's just my computer, or if maybe I have to do a little bit at a time.
You have to press Control V. You can't right click. You have to press Control V to paste it.
Awesome. Okay, thank you.
No problem.
Yeah, I would try that. I mean, worst comes to worst, some of y'all definitely uploaded the Word documents. That creates a little, I'm not saying don't, My preference is please cut and paste into the discussion board, because then I can read them easier and I can grade them easier. It's an extra step for me to download the document that you upload. So if at all possible, if you don't have any technological problems, please do just put that straight into the discussion board. I also set it up like this so that you all could continue to learn from each other, so that you could peruse the other folks' CTEs and all that good stuff. So wanted those to be a little easier to access for everybody. Control V. All right, that's the magic thing there. Okay, any other questions? Thank you for bringing that up. That was actually on my list and I forgot, so thank you. Any other questions?
I have one question.
Yes.
I think a lot of the articles focused on early childhood interventions. I was wondering if there have been any studies about, I guess, adolescent interventions.
I have not seen much. We don't, when I teach this in 513 and we go through the lifespan, we talk a lot about adolescence and transition age to adulthood, and we get into some interventions with that. I actually posted some videos under the brain unit that touch on the teenage brain and all that kind of stuff and make a few of those connections. But I haven't seen, aside from ACEs, I haven't really seen any connections between epigenetics and adolescence in terms of intervention. That doesn't mean that they don't exist, but I haven't seen those. Does that answer your question?
Yeah, I
think it's a great.
Yeah, I have this prime case that fits a lot of what we've been talking about, like the self-fulfilling prophecy. I was curious.
Yeah. So I think it's a really important question. So I think if you want to email me some more detail, I'll see if I can get my wheel turned in and see if there's anything else I can come up with. I'd be happy to look at it.
Okay, thank you.
All right, great. All of y'all can always email me with any other questions. Any last thing? Any last comments, questions?
Not to put any pressure on you, but just as a general question, when should we expect feedback for the CTE?
I'm trying to get those out by the end of the week. I'm hoping I don't think I can get them done in one day. So I'm going to try to kind of get those done. Realistically, because this is my first round with grading all of these, this many, it's quite a few. It's over 40, I think. So realistically, this week, it will probably be this weekend, but I will do everything I can to get those done. And please continue to hold me accountable. I really want to get these back to you guys before you have to submit the other ones. So I'll get them done as quickly as I can.
Thank you.
Okay.
I have one question about, so essentially a lot of the articles that we read were about nurturing, in the sense that people did really well, or rats did really well whenever they were nurtured well. So why is it that we have a policy within, like the family preservation policy within the foster care system? Kind of like if a family isn't able to provide the necessary nurturing to that child, is it really better for them to stay there?
That's a really big question that I do not have an easy answer for.
You don't have the time to answer?
Yeah, well, it's just it's a really big question. I think, again, everything goes back to values, and it also goes back to the best, people are doing the best thinking that they know at the time. And so all of this is really new, but when you think about it, whatever practice or policy that you guys are in the middle right now in the field, it is based on information that is, probably goes back to the 90s, just because that is the flow of how things go. So I expect that as this information, is more, widely accessed, and there's more research around it, and more people like you all asking really good questions to policymakers, and being on state task forces and asking these really important questions, I do think that things will start to change in that direction. But I don't have an easy answer for that.
No, that's helpful. Thanks.
Okay, it's a great question though. All right. I love that you guys are so passionate about this. Makes me happy. Makes me happy. All right. Going once, going twice. All All right. I hope you guys have a wonderful rest of the week. Please email me with any questions, and look forward to seeing all your faces next week. Have a great one.